Let's talk about acne and pimples and what you can actually do to get rid of them. We're going to talk about lifestyle tips, we're going to talk about skincare routines, and we're going to be talking about treatments. So, what are we waiting for? Let's begin. Okay, so let's begin with tip number 1. Let's start talking about diets, okay? There is some evidence that suggests that having a diet high in high glycemic foods can potentially make acne worse compared to diets consisting with low amounts of high glycemic foods. Now, if you want a full list of these sort of foods, I am going to leave more information in the description below. Moving on to tip number 2, there is some evidence that milk and dairy can increase or trigger acne. The evidence is less consistent compared to the high glycemic food that we spoke about just now, but if you do want to sort of cut out dairy and milk, okay, you need to make sure that you replace it with a dairy-free alternative, basically, only because you're going to be lacking on calcium otherwise. So if you're going to replace it, make sure you get a dairy-free alternative. Moving on to tip number 3, you need to make sure you're changing your pillowcase every day. Your pillowcase is going to be full of oil, it's going to be full of dead skin cells, and it's going to be full of bacteria that builds up on it, all of which can make acne worse. Now, the easiest way that I found to do this, I bought 14 pillowcases, I change them up every single day, and then on the weekend, I wash the 7 used ones, and then I've got another 7 spare, and I can keep rotating it like that. Okay, moving on to tip number 4. If you have long hair and it gets on your face, it can actually irritate the skin and make acne worse, especially when you're sleeping. So when you're sleeping especially, tie it up or put it in a bonnet. Moving swiftly on to tip number 5, stress. It has been shown that stress can increase the amount of acne that we get. So you need to learn different techniques that are going to help you handle the stress, okay? I do have a few videos on the topic, I'm going to leave it up here and in the description below, so make sure you get on top of the stress, which is going to help with the acne. Let's move on to the next tip. Okay, so moving on to tip number 6. Tip number 6 is all about cleaning your face. Make sure to use a gentle cleanser, and lukewarm water is completely fine, okay? Maximum you need to be washing your face is twice a day, no more than that, okay? Don't overwash, don't over scrub, don't use super hot or super cold water, don't use those exfoliation creams that are really harsh on the skin to wash your face. Don't use any of them, because all that's going to happen is it's going to inflame the skin, make it worse, and also it's going to increase oil production, which makes acne worse. Lastly, once you finish cleaning your face, just gently pat it dry with a nice clean towel. Don't scrub again, because all that's going to do is make the acne worse. Moving on to tip number 7, if you wear makeup, you must make sure that you wash it off before going to bed. And also with any products, makeup, moisturizers, creams, anything like that, always look for the word non-acnogenic, non-comedogenic, which basically means it's been tested and it doesn't block those pores. And moving on to tip number 8, once you finish washing your face, to prevent it from becoming dry, use a moisturizer. Make sure it's a light, non-comedogenic one that we spoke about, and make sure it's not too greasy or oily, and definitely avoid ointments. Okay, so moving on to tip number 9. This is a pro tip. Always, before going out, make sure to wear a sunscreen. Make sure it's non-comedogenic, it's not greasy, all that sort of stuff we spoke about earlier, but make sure it's SPF 30 as well. I highly recommend doing this, because what that's going to do is protect the skin, stop it from scarring, and also pigmentation, all caused from the acne that's healing on your face. Moving on to tip number 10. Please do not pick those spots. All it's going to do is increase inflammation, increase redness, I can't speak, and increase soreness, okay? And worst of all, it will increase your risk of scarring and potential infections. Now let's continue back in the surgery. So moving on to tip number 11, let's talk about medical treatments. One of my favorite medical treatments for acne is topical retinoids. Why do I like them? Well, retinoids reduce pore obstruction. This can be really helpful with acne, and on top of that, they reduce the inflammation of acne, so it's a win-win. Now please do remember though, retinoids increase the skin cell turnover, so because of this, it can cause a bit of redness, a bit of irritation to begin with, but this does settle down after a couple of weeks. You just need to bear with it. Moving on to tip number 12, it's all about reducing bacterial overgrowth. Benzoyl peroxide is really good at killing bacteria, okay? And it can be one of the foundations actually of acne treatment. It can be used with a retinoid as well. There is a combination product available as well, which can be very helpful, and it makes it a lot easier to apply. Now please do remember, benzoyl peroxide can bleach your clothes, it can bleach your pillowcase, your bed sheets, your towels, so please do bear that in mind, but it can be very effective at acne treatment. It's like I said, it's one of the foundations, and when it's used with retinoid, it can be even more effective. And moving on to tip number 13, please be patient with these treatments. Look, it can take up to 2 to 4 months for these treatments to actually show their effect. And that's because skin cells take a long time to regenerate and renew, which is then going to show actually how effective it's been. So please remember that. And moving on to tip number 14, always treat acne as soon as possible and always speak to a healthcare professional as soon as possible. The thing about acne is, the sooner you treat it, the less likely you are to get scarring and any problems in the future. And involving a healthcare professional can mean that they can do a step-by-step approach on your treatment. If these topical treatments aren't working, they might start you on antibiotics. They might start you on oral isotretinoin. So these are the important reasons why you need to speak to a healthcare professional. We've come to the end of this week's video. I really hope that you find these tips helpful. Always remember you're awesome, and I will see you next week. Honestly, it's so warm right now here in the UK. It's like 35 degrees. If anyone ever thinks I don't enjoy filming, it is literally the highlight of my month when I film. This is a sound test, can you hear me? Don't use super hot or super cold water. I don't know if I've already said that bit, but this bird just keeps like birding away. And that's why I don't like filming outdoors usually, because there's all these different factors that stop the filming process.